We'll also consider the Modern Labeling Act of 2020, introduced by Representatives Matsui and Guthrie. This bill gives FDA the authority to require modifications of outdated labeling for generic drugs in order to ensure they represent accepted clinical uses. Representatives Guthrie and Engel have a bill that would allow FDA to destroy medical devices found to be adulterated or misbranded. The FDA already does this with drugs, and this will keep potentially harmful medical devices from entering the supply chain. We also have a bill introduced with Mr. Guthrie that, well, this is my bill with Mr. Guthrie that directs FDA to designate national centers of excellence in continuous pharmaceutical manufacturing. These centers will help limit drug shortages in the future while spurring a new generation of manufacturing jobs here in the U.S. And then we have a number of bills that aim to improve health outcomes for kids.
Thank you very much, Madam Chair. Recognizing concerns from stakeholders, I have been working in a bipartisan way with my co-lead, Representative Brett Guthrie, the Chairman's office, and other members of our committee to ensure that we continue to protect patients while creating a pathway to modernize generic drug labels. This amendment includes a new provision to clarify that the process created under this bill to update labels for new conditions of use cannot be used as an alternative pathway to initiate safety labeling changes. Safety changes must continue to go through FDA's existing safety pathway. We are making progress, and I look forward to continuing our conversations with stakeholders on improving this bill as we move to full committee markup. Prescription drug labels are the most readily available and trusted sources of drug information, and I'm significantly concerned that current law limits modernizing many older treatment labels to reflect the latest clinical evidence. The Modern Labeling Act will make sure that Americans have access to reliable, high-quality sources of information to help make the right healthcare decisions. I encourage my colleagues to support this bipartisan bill to strengthen the role labels play in informing treatment decisions, safeguard our public health, and facilitate greater use of lower-cost generics. With that, I yield to my colleague, Mr. Guthrie.
Thank you. I thank the gentlelady for yielding. And Madam Chair, I accept this amendment, urging my colleagues to do the same. Congresswoman Matsui and her staff, committee staff, and my staff have been working hard to ensure that labels of generic drugs with no brand can be updated to help patients receive the best possible care. I'm glad we have been able to work in a bipartisan way on this bill and look forward to this bill going forward to the full committee. And I yield back to my friend from California.
I yield.
Will the gentlewoman yield this?
Yeah, I yield to the chairman.
Pardon me? Does anyone want to speak on the bill? No. Does anyone wish to speak on the bill?
Yes, I'd like to speak on the underlying bill.
I think we need to go to our Republican colleagues. The chair recognized, were you seeking recognition?
I was seeking recognition, yes, ma'am.
The gentleman is recognized.
Thank you, and I appreciate sharing the time with my friend from New York. We worked on this together. This came from my tour and our tour. I think you've toured as well. My tour of JFK Airport. And what we found were there were products that the FDA has the authority to destroy counterfeit drugs, but not counterfeit medical devices. So if the drugs were packaged or contained or within a counterfeit medical device, we had agents say that they had to return to the return address, send back, and sometimes they saw it come back exactly as they returned it into the country. So this bill would give authority for them to destroy illicit medical devices, which includes combination products, and it'll strengthen our supply chain. This bill will improve the ability of the federal government to curtail the supply of counterfeit medical products in the United States. I really appreciate my friend from New York, Congressman Engel, for working on this bill with me. And I can yield him the rest of my time or yield back. And I yield back if he'd like my time. He's welcome.
I'll take your time.
You're welcome.
Yes, thank you. Thank you, Chairwoman Eshoo and Chairman Pallone, for holding today's markup, including my bipartisan bill with Congressman Brett Guthrie. And I want to thank the gentleman for working on this bill with me. This bill is called the Safeguarding Therapeutics Act, and it provides the FDA with another tool to protect the American public by allowing the agency to destroy counterfeit medical devices. Now, counterfeit medical devices are a growing public health threat. And let me give you an example. Just this past February, the FDA, in concert with the Indian government, stopped a batch of illicit medical products, which included counterfeit combination medical devices destined for the United States market. With the growing coronavirus outbreak, including more than 100 cases in Westchester County, which I represent, we can expect that criminals will try to make a quick buck by selling fake treatments and medicines to concerned Americans. I urge my colleagues on both sides of the aisle to pass this common sense bipartisan legislation and protect Americans from dangerous medical products. I want to again thank my friend, the Congressman Guthrie, for working on this with me. And Chairwoman Eshoo, I ask for unanimous consent to submit into the record a letter of support from the Health Industry Distributors Association in support of our bill, H.R. 5663.
Without objection, so ordered.
Thank you. I again urge my colleagues on both sides of the aisle to pass this legislation. I yield back the rest of my time.
Thank you, Chairwoman Eshoo. I'm pleased that today we're considering a bill that will help to advance continuous manufacturing here in the U.S. The ongoing coronavirus outbreak has reiterated the need for the U.S. to take steps to help reduce our reliance on foreign manufacturing. As we heard from Dr. Woodcock last fall, advanced manufacturing technologies such as continuous manufacturing can help to reduce the nation's dependence on foreign sources of APIs, increase the resilience of our domestic manufacturing base, and reduce quality issues that trigger drug shortages or recalls. This bill helps to invest in continuous manufacturing by directing FDA to designate academic institutions and other nonprofit organizations with expertise in this area to help advance continuous manufacturing technology and standardization, develop a continuous manufacturing workforce here in the U.S., and to make recommendations for how the FDA, industry, and others can expand the use of continuous manufacturing of drugs and biologics. And I believe these centers will be critical to helping industry and FDA better understand this technology and to encourage greater adoption of the use of continuous manufacturing that will help to bring manufacturing jobs back to the United States. The manager's amendment incorporates technical assistance and feedback from stakeholders to clarify the intent of the bill. I want to thank my colleague, Representative Guthrie, for his support and for working with me on this bill and the amendment. And I look forward, Madam Chair, to continuing to work with stakeholders as we move forward. I urge my colleagues to support this amendment, and I yield back.
The chair yield?
Yeah, I yield to the gentleman, sure.
Thank you, Mr. Chairman. I appreciate and working with you as well. And Madam Chair, I'd like to speak in support of the amendment. I do want to thank Chairman Pallone for working on this important issue with me and allow me to be part of working on this. And during the hearing on H.R. 4866, we learned how continuous manufacture could help with drug shortages that we now face. We talked about that in the drug shortage we face in the future, and we're at that point where there are issues as we're dealing with the coronavirus. I believe this bill is crucial in order to ensure Americans have access to medicine they may need when they need them, and urge my colleagues to support this bill. I appreciate all the working together, and I will yield back to the chairman.
Gentlemen,